How's it going, guys? Slightly unusual question for mixed Pharm micro neuro. If you have disagreements with things you see here, take it up with internal medicine form 6 for 2CK clinical mastery series forms, okay? Very similar question where they give you this 90% monocytes, 10% neutrophils here, okay? Not my fucking opinion, but I'm going to discuss it, okay? You should know this stuff for USMLE. And then I increased the difficulty by making it about mechanism of action of the pharmacologic treatment. Okay, the 2CK question, they just ask for the name of the drug. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the question. 38-year-old woman comes to the physician for a 1-week history of severe headache, neck soreness, photophobia. She has a history of Hodgkin disease for which she has been receiving chemo and radiotherapy. Fever 101 Fahrenheit. Results of a lumbar puncture are shown. Low glucose, elevated protein, elevated leukocytes, 10% neutrophils, 90% monocytes. No RBCs. Question wants to know the most appropriate pharmacologic therapy for this patient. It inhibits which of the following. So let's just walk through the answer choices here. Actually, I'll explain the vignette a little bit more first. So when we look at this breakdown of the cerebrospinal fluid, what you need to know is that viral will be normal glucose, normal or slightly elevated protein, and high lymphocytes, okay? That's not what we have here. In the event, so if we have a typical viral meningitis, an aseptic meningitis, such as due to echovirus, okay, one of the enteroviruses, if we have RBCs in the CSF in the setting of a fever, confusion, you want to think of herpes encephalitis, HSV 1 or 2, okay? Very important you know that RBCs can be seen in the CSF with herpes. Now, when we talk about bacterial and viral meningitis, both of them will have low glucose, high protein, and then it's the leukocytes that differ. So in bacterial, you're going to have high neutrophils. In fungal, you're going to have high lymphocytes. Okay, so viral and fungal both have high lymphocytes. Now this question, we have an immunocompromised patient as due to the chemo radiotherapy history, Hodgkin disease, okay? They could have given you HIV, doesn't matter, but it's immunosuppression in the setting of a meningitis. We want to think fungal, okay? And this monocyte shift can be seen in fungal, all right? It's unusual, but as I prefaced at the start of this clip, it's not my fucking opinion. It's on internal medicine form 6, okay? Actually, sorry, not internal medicine form 6, neuro form 6, okay, for the clinical mastery series forms. So what's most appropriate pharmacologic treatment inhibits which of the following? Let's just walk through the answer choices here. We'll go backwards. Choice E, epoxidase, wrong fucking answer. This refers to terbinafine. Okay, so terbinafine would inhibit the conversion of squalene to lanostril by inhibiting squalene epoxidase. And terbinafine oral would be used for onychomycosis nail bed infection with fungus. Topical terbinafine, classically used for tinea pedis. Okay, wrong fucking answer. Choice D, DNA polymerase, wrong answer. This could refer to acyclovir / gancyclovir. Okay, so as I mentioned before, if we had herpes encephalitis, we could give acyclovir for that. Wrong answer. Choice C, demethylation, wrong answer. This refers to azoles. Okay, so when we have like fluconazole as an example, that will inhibit the conversion of lanostril to ergostrel. Ergostrel is the fungal cell membrane equivalent, but that conversion occurs via an enzyme called 14-alpha demethylase. So sometimes if the question on the step 1 wants fluconazole as the answer, and they ask for the mechanism of action, you need to know that azoles inhibit a P450 mediated demethylation reaction. That's how they can write it. Okay, that confuses students. Demethylation, that's azoles, wrong answer. Choice B, cell wall synthesis, wrong answer. So this could actually be fairly non-specific if we had vancomycin as an example. So if we had a bacterial meningitis, which we don't, vancomycin plus ceftriaxone, that's the empiric treatment. Okay, so both are going to affect the cell wall, the cross-linking. In addition, if we had a situation like invasive aspergillosis or candidemia where we use caspofungin, the echinocandins, okay, caspofungin inhibits um, beta 1,3 glucan synthase. Okay, I'm like cracked out right now. Haven't had a coffee yet, so I had to like think about that for 2 seconds. But it's like, okay, what am I gonna do? Restart the whole fucking clip right now? But beta 1,3 glucan synthase. Okay, that's cell wall carbohydrate synthesis. That's the echinocandins, caspofungin, mycofungin. Wrong answer in this case. The correct answer is choice A, cell membrane integrity. Okay, so they want amphotericin B for fungal meningitis. In real life, it's amphotericin B plus flucytosine, followed by a 1-year fluconazole taper. But I've seen them just ask straight up amphotericin B for multiple Cryptococcus neoformans meningitis questions. Okay, so amphotericin B pokes holes in the cell membrane, the ergostral membrane, the same way that nystatin does, except we use topical nystatin, the mouthwash, for oropharyngeal candidiasis as well as vaginal candidiasis. Okay, but amphotericin B is for severe fungal infections, disseminated, where a patient has fungemia, so rigors, chills, high fever. If the patient has CNS fungal infection, we use amphotericin B. Okay, a lot we can chat about, but your take home here is that for whatever fucking reason, fungal meningitis can present with a monocyte shift, because when we look in resources, it's classically elevated lymphocytes. Neuro Form 6 for 2CK. Not my fucking opinion. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.